Welcome back to the Oregon Housing Conference. I'm Jason Renaud, the conference coordinator, and right now I'm with Matt Tinoco, reporter and writer in Los Angeles, and has been covering homeless issues for a few years. Matt, welcome.
Hi, Jason. Thanks for having me.
Tell us what you've been doing.
Well, I am a reporter in Los Angeles. I grew up locally. Until very recently, worked for one of the NPR affiliate stations, Southern California Public Radio, KPCC, where I was full-time as the staff homelessness reporter. Homelessness and housing, but it was largely the crisis outside. And prior to that, I've also worked as a reporter at other local and national publications, both as a staffer and as a freelancer. So I've always, for the amount of time that I've been a professional reporter, about 6 years or so, I've one of the very first stories I wrote in maybe 6 or 7 years ago were also on homelessness. So it's been a consistent thing that I've been reporting on locally.
Great. And thanks for bringing your expertise to us. We've heard a little bit about homelessness already in Los Angeles. It's so complex, it's so large, and there's so much money involved. It's really out of scale for the rest of us. How do you go about reporting on these huge geographical area? How can you possibly know what's going on?
I think the scale is actually what makes it very difficult. Just the scale of the sort of Los Angeles metropolitan region, which I'm not like, you have LA County, which is a 10 million person county, but you have Orange County, San Bernardino County, Riverside County, Ventura, and then you could maybe even throw San Diego into we're all on the same water and electric grid, right? It's the same sort of thing, which is too big comprehensively for any one individual or any one government to sort of get at, which I think the point would be is that as large as it is, though, the sort of same thing happens at a local scale. So usually what I do is I focus on a couple specific neighborhoods that I know well, and that's the best as any individual person I can do. And yeah.
And so let's dive in. COVID starts in China in January, gets to Los Angeles by the end of February. And when do you start seeing the homeless operators, shelter operators, public health officials start to talk about COVID?
It was on the sort of same timeline as, I don't want to say everybody else, because I know there's a lot of people watching this call from a lot of different places. But it was early to mid-March, the sort of second and third weeks of March, which was where the state and the county issued their stay-at-home orders earlier than I know a number of other places across the country. And that was sort of when it happened. There was, up until then, there is this new novel coronavirus, and it's quite something. Maybe we should watch out for it. But it wasn't really until the stay-at-home orders issued that I think things really changed. And by change, I mean, it basically shut off. So with regards to you had these sort of two parallel things happening at once. You had the homeless services system, and then you had the lived experience for people outside. The services system basically just slammed on its brakes. There was no more direct outreach. You had to figure out how to decompress the shelter system, because our congregate shelters, as I'm sure everybody at this point realizes, you can't social distance in a big room with 80 or 90 cots in it. One of my first pieces of reporting was actually on a winter shelter that they shut down. The winter shelters usually, there's not that many of them, but in Los Angeles County, they usually run until about mid-March. And this was one. Some of them were extended because at the time that our shutdown happened, it was a very rainy March. It was an uncharacteristically rainy March. And well, the shelters are shut down because I don't think they wanted to keep open with the coronavirus pandemic occurring. But the effect was that the services system basically stopped. Like I said, there was no direct outreach. There's very few people going out to actually serve people outside. The housing placement system the brakes were applied there too, because, well, we can't even see people to place it. And it gradually sort of came back slowly in the course of the month or two into April and May. Then you began to have some housing placements, but even then it hasn't recovered, because there's still, my understanding is that there's a number of permanent supportive housing projects that they penciled out before and were going to happen, but now they're not, it no longer pencils. So there's still sort of some fallout even today from that initial shutdown. but then you also have the situation for the people who are outside, where again it's a rainy March. So now the work of survival living outside became that much harder because you lost access to infrastructure that you could normally rely on. Hard as it is, you can find a bathroom, like a fast food restaurant dining room. You can use a bathroom in there, and maybe it's a 24-hour restaurant, so you could shelter in place inside. Which now those all that infrastructure is, you can't go into the dining room at all. Another big one was we have an enormous population of people who live in their vehicles in Southern California. Orders of magnitude higher than the official estimate, which is only, I believe it's like 7,000 or 8,000 for LA County. But no gyms. That was my point. The gym shut down. There's a huge number of people who
showers
rely. Yeah, and yeah, exactly. Like for that population, they rely on the gyms for showers and cleaning. And like, well, there's no gyms anymore, so you have to figure something out. Like I spoke to a fellow who was just using water bottles and showering out in back of his car that way. Mm-hmm. But I think that was the initial sort of shock.
So did you also see, say, ancillary services like mental health treatment or addiction health treatment withdraw?
It would be consistent. I would have to, like, each individual provider operated independently. So there would undoubtedly be some, and I know of some that continue to provide a bare minimum of like, we'll drop off a charged cell phone so we can talk over the phone this way. But there was no cohesive centralized strategy. Even within LA County, its own one county. I can't speak for counties outside of LA County with regards to how their continuum of care is sort of immediately reacted. Mm-hmm. But I can't imagine it's that different. There was an overall immediate reduction of services, whatever services is defined out of in that initial sort of shutdown.
So as you're seeing the likelihood of COVID to arrive in California, was there a move to create some additional housing?
Not immediately. There was a sort of, the fear consistently was that the virus would sweep through the unsheltered population more quickly than everybody else. That did not manifest, and it actually seems that the unsheltered population, there's by proxy of being outside, have almost a lower transmission rate. I don't know if that's settled science, though, so take that with a grain of salt. But that is a theory that has been circulated. But in that immediate initial time, everybody was worried about that. And more specifically, I don't, just to jump ahead a little bit, but as Project Roomkey, at least that's the California branding of the FEMA federal, what is it called? Non-congregate shelter FEMA reimbursables, where a county can reimburse the federal government for putting people up in a hotel. Mm-hmm. An explicit worry on the part of the state government was that the virus would go through the unsheltered population so quickly and send a huge number of people into the hospital, potentially overwhelming the state hospital system just with the people outside. That was a very tangible worry on the part of California state government in sort of March, April, which was one of their drivers for reacting. Like, there was no proactive, we should create shelter seeing this coming. Like in February and even early March, that was not on the discussion. Once the virus was here, and especially once we had the sort of images of New York City and everybody's holding on, is this going to happen here? Then there was a bit of urgency. And so the first immediate thing that the city of Los Angeles, distinct from the county of Los Angeles, was they started opening up the city's recreation and parks departments has a bunch of recreation centers in the parks. And the city's first immediate move was to promise opening 6,000. They were going to produce 6,000 beds in 40-something city recreation centers. Unfortunately, that 6,000 beds number was it didn't happen because basically of the need to physically distance people inside. These were congregate shelters. It was cots in a room. Very, very bare bones, very set up immediately. And so the result was, I don't think 40 of them ever opened. I don't know if more than 20 or so of them ever opened. But on whole, there was fewer than 1,000 beds that we were able to get out of that. And in the city of LA, and bear in mind that the city of Los Angeles's total, at least its point in time count population, is about 44,000 this year.
And what do you think that is a part for estimation, conservative, liberal? What do you think the real number is?
That's a hard one. For the county of Los Angeles, I mean, I've had just on that like vehicular, like there's like define homelessness, right? Mm-hmm. So the LA County Office of Education, using a federal definition set by the Federal Education Department, the McKinney-Vento definition, estimates that there are somewhere between 60 and 70,000 homeless K through 12 students. Now that definition, it's a massive number. Like that's like 60, and that's so I think it was 68,000 in the last year. That definition includes people who are couch surfing or living in a motel, which the federal HUD definition, the usual like homeless count number, does not include that. So that's a differentiation. So LA County's point in time number for the entire county, of which LA City is one city in, this past year was over 66,000 people.
But once someone gets out of the homeless system, that means there's many people vying to get into that homeless system.
Yeah, and that number includes people who aren't, like, it's supposed to include people who aren't even in the system. Mm-hmm. But I do think the actual reality number is much higher than that. Especially if you include people who are in motels or like you have families that are doubled up in studio apartments. On the vehicular habitation number, I've had people in, like, nobody will say it explicitly or nobody will ever say it on the record, but like candidly, people will estimate that there are probably, like, I've heard it in several places, that there are maybe 100,000 people living in vehicles in Los Angeles County, which is like in the sort of cascade down of housing insecurity. The people who are outside on the street in the tents are the very, very bottom of like an enormous sort of funnel. So if we estimate there's 30,000 people outside on the street, you have, like, add a zero to that, that's the number of people who are like right about to be there. The number, and that's the hard thing though with all this, is that the numbers are just very, like, in any jurisdiction, the point in time count is not going to be a very reliable metric. I would advise everybody to check with your schools on the McKinney-Vento number, because I think that's a better number with regards to family, just in terms of the scale of housing insecurity. Like the HUD point in time count follows a very strict definition. The McKinney-Vento education, whatever your county's Office of Education or whoever is the responsible agency for determining that sort, like asking each school how many students, because the schools have to keep track of this, that will give you a different number that I think is to some extent more reflective.
But to stand up a public health response such as adequate testing would take almost a military presence. Yes,
and one of the things that I think we've seen, even in the, because that was like the non-government response, the basically like the mutual aid volunteer response, which in the very beginning, you also had the city and county made an effort to roll out hand washing stations to their largest encampments, because the government, at least here, knows where everybody outside is for the most part. There's very detailed, I mean, there's a very proactive surveillance mechanism that keeps track of where people are outside. And so when it comes to distributing resources like a hand washing station, the government here at least knows where the largest camps are and like what needs to be done. So there were hand washing stations rolled out. They replaced hundreds of hand washing stations around the city and county. But then the immediate challenge came that they weren't even being refilled because the contractor, like, they ran out of time. There were too many of them. There were a bunch of like other issues like that. So eventually a bunch of those hand wash stations were just removed because I can't remember. I don't remember the exact reason actually on why they were removed, but they were. But the point what I was saying about like the mutual aid is that then you had other basically advocate organizations, not even like NGOs who contract with the government for the direct provision of homeless services, but the homeless advocates, the providing coming in and stepping, like this happened at least in LA Skid Row. You had the LA Community Action Network and the Catholic workers step in and produce their own hand wash stations to serve that population there, because what the government provided was not adequate.
Toilets, tents, what other resources were made available to people who were unsheltered?
A big one was food, because you had that sort of, as dining rooms shut down, you're losing a key way that, like the McDonald's dining room is a, like I haven't ever done this as a story, speaking it just as like a reporter, but there's a very like, or I mean, a social scientist could do this too, but in terms of understanding the role of a like fast food dining room in a poor neighborhood as like a node of social services, loosely defined social services, but like bare life services. You get food and water and you can clean yourself. And it's also some sort of shelter. But those, like I said earlier, were not present. So people, like there was in that first month, there was a very tangible, like people are really hungry. And food distribution was one of the immediate concerns on behalf of advocates, as well as the city, because you also had to stand up this infrastructure to do the hotel, like where we got to the hotels, you have to provide meal infrastructure there, as well as at the recreation center shelters. You had to, okay, well, how do we feed people? We're promising people food, but we need to actually figure out practically how to do that. There was the whole, like the phrase that got repeated to me everywhere was that we're building the airplane while flying it. But like very much so. And yeah, I guess now we're several months past that, but like in that immediate early time, it was one of the big problems was food, and it was quite dire for many people for like that in that initial period, in that first lockdown, everything's silent period.
Did you find anybody in the county or city who had done any disaster planning with the homeless community in mind?
That's a good question. I don't know. I know that the County Office of Emergency Management stepped in as a sort of coordinator, but I don't think there was a plan, honestly. I don't think there was certainly no like, okay, in the event of a viral pandemic, we will do X, Y, and Z to meet the needs of the people outside. That did not exist. Mm-hmm. I do know that the Office of Emergency Management did step in relatively early as a sort of coordinating agency.
So back to politics for a sec. You mentioned the county and the city. How do they get along and communicate about what to do about homelessness in Los Angeles? They have a joint office.
Oh, say again.
They have a joint office that they've created.
Yeah, that joint, it's a joint powers authority, the Los Angeles Homeless Services Los Angeles Homeless Services Authority, LAHSA vernacularly, it's a JPA that was created in 1994, I believe. I think it was early 1994 or late 1993, largely as a result of litigation that had kicked off in the late 80s. Over precisely this, is whose responsibility is it to take care of people who are outside? Lots of litigation about that in the late 80s and early 90s that resulted with LAHSA, which is both the city and county of Los Angeles. Those are the two government authority or government bodies that like basically fund LAHSA. Although LAHSA is also in charge of our local continuum of care, which means that they also are the receiver of federal block grants from HUD. There's always historically, like what I just said, you had litigation in the 1980s where the county and city are squabbling over who's gonna pick up the check. Mm-hmm. I think at this point where we are, the city will say we're going to pick up the tab for like capital development and building of hard infrastructure, and the county will say we're going to pick up the check for the direct provision of services, whatever like the mental health, the substance abuse, the everything. Mm-hmm. And that still holds true. The local context for money, which I don't know if we mentioned it before on the recording or off, but like there is a presence of a relatively large amount of local money, which the county, what was it? It was LA County voters in early 2017 passed, it was called Measure H, which is a 1/4-cent sales tax with a 10-year sunset to fund the provision of services. That's a county-wide tax. That is to provide services for everybody who's experiencing homelessness in the county of Los Angeles. A couple months before that, November of 2016, the city of Los Angeles voters passed a $1.2 billion general obligation bond to build permanent supportive housing, basically the type of housing that, like steeply subsidized housing with supportive services for those most in need. And that was and that has held true kind of since, whereas the city will. But also the city, when I say the city, I'm referring to the city of Los Angeles, which is one of 88 cities in Los Angeles County. It's the biggest, like the LA city is 4 million people. It's the largest individual city, but it's also not, I hesitate to say the city, like I live and work in the city of LA and that's usually where I am. But it's one of 88 cities. So then you have all these other municipalities that like, for the most part, are more reliant on the county to provide money for both capital development and provision of services. Although those individual cities sometimes, like it varies for each individual one. For LA City though, it is they rely heavily on the county to provide service money, and the $1.2 billion bond will be paid with property taxes over the next number of years for the development of permanent housing. So, sorry, there was a rambling answer, so go ahead.
But Los Angeles has solved one of the big problems that other cities has not, which is money to do these things.
I would hesitate to say it's solved because I think just working as a reporter, so Measure H, the countywide sales tax, is supposed to bring in about $350 million a year, which is that is a big pile of money. LA County's overall budget is like 36 billion, 33. It's in the mid $30 billion a year. So like as much money as $350 million is to you and me, it is a drop in the bucket with regard to the scale and need of the like population it is. And I think this holds true everywhere, is that unsheltered homelessness in particular, like housing insecurity is massively expensive to start with for a lot of different ways that you can demonstrate with a social science background. But in terms of like managing unsheltered homelessness, the most like visible sort of aspect, that is also it's just tremendously expensive. And it goes much more beyond just what that like homeless budget is, or that $350 million is. Like, I think the county in 2015 or so, it's now relatively out of date, but the county estimated that they spent almost $1 billion on the sort of the frequent flyers, a small subset of the basically sickest people living outside. The county estimated it was just under $1 billion. It was like $980-something million each year on just these very small subset of the population that were the most expensive. And if you're spending $1 billion on the sickest like 3,000 people outside, $350 million for a overall population that is officially 66,000 is probably more than that easily. It's just it's like something. But when local officials hold up the ballot measures that voters have passed, it is in a sense monumental to try and like that you had voters pass a tax increase on themselves to deal with the problem. But also, it's just not that much money. Like I'm sorry to say, like relative to the scale of the problem, which is where I come to, like, you need the federal government to come in and just pour billions of dollars in it, because anything short of that, like a local city, especially now, like one of those smaller 88 cities, like their bank accounts are already stressed and they do not have the cash to pay for not like services, the development of any capital infrastructure, or even to just pay their like contract EMS agency to take people to the hospital at this point. Which is, I mean, that just goes back to what I said a second ago. I think you need the federal government to step in, but that's a digression. So there is the presence of local money is a big difference from many other jurisdictions. It is not It's nowhere near enough, though, and I don't think you'll find anybody locally who works in that sort of space. Like, there is a lot of money and it could be used better, yes, but like at a zero, and I think maybe then you're getting to a better spot.
So, talk a little bit about the litigation that's going on now that is trying to wrangle these issues a little bit better.
There's always been a lot of litigation about homelessness in Los Angeles City and County. What happened earlier this year is you had it's a group of property owners, for the most part, in downtown Los Angeles, in the Skid Row area, that filed a lawsuit against both the city and county of Los Angeles, alleging, there's a long list, there's many causes of action, but the effect is they filed the lawsuit alleging gross negligence on the part of handling mass homelessness, and asked for a federal court to intervene. They want a consent decree. They want a judicial oversight handling this. And we're not to exactly explicitly to a consent decree yet, but there is a federal court overseeing now largely how the city and county are sort of producing beds, I'll say, at this point. And even like the case was filed basically early March. And it's played out very much on the similar timeline as the pandemic. Like, the first hearing was like, I believe the very first hearing was on a Thursday that I attended, but it was also the same day that our stay-at-home order was issued, and it was sort of like, well, you could not separate the two, the pandemic response from this court case, and we still can't. Like, it's kind of, I mean, it's gone from there, but yeah. So, and that's basically, how do I distill this? Court case. The case is entered into the jurisdiction of one in the Central District of California, and it's under the oversight of a judge, David Carter, who is very active in this space, because even in previous years, there has, like, in the like past couple of years in Orange County, there was, stemming from the breakup of a large Riverside homeless encampment, there was subsequent litigation that was basically saying, sort of in context of the Boise case, I mean, not sort of, but in context of Boise, the argument was that you cannot break up this camp without providing alternative shelter for people to go to. And long story short, now, Carter is the sort of responsible judge. He is the provider of oversight for more than 24 cities and not just Orange County. I think Riverside's also in there, but largely Orange County cities that are trying to broker that, like, balance that is loosely articulated in the Boise decision. In that, we have a responsibility to provide beds, but we also want to enforce our anti-camping laws. And basically what's happened in about 24 cities around Southern California is that Carter has brokered over an agreement. It's a little dog. Carter's the judge overseeing an agreement between plaintiffs and advocates for the home, between the cities and advocates for the homeless, sort of like getting something down on paper that if you build a shelter in your jurisdiction for X number, like it's 60, the number here locally is 60% of the point in time count. Okay. For whatever reason, Carter has a reason, but that is where we are, because everybody's just throwing at the wall whatever they want to see will stick. Yeah. So, and then the LA Alliance case was filed with the intention of having that replicated in the city and county of Los Angeles. Okay. Admittedly, though, the city and county of LA are much, much larger than any of those individual cities. So the situation's a little bit different.
And that outcome is going to play out over maybe several years.
Yeah, where we are right now is that the city and county have agreed to provide 6,700 beds by, I think it's 6,000 by next April. And then 6 months after that, they have to do another 700. That is the initial sort of get.
So in the midst of this human crisis of homelessness, top it off with a pandemic, and now you have a consent decree. It's quite a bit of work to confines to work within.
It's a lot, and Yeah, there's a lot going on. It's very hard for individuals to keep track of things change very quickly, just for even those working within the system. Meanwhile, you still have people who are trying to provide direct provision of services, and also you have everybody outside, which again, like if the goal is we're going to produce 6,700 beds by mid next year, bear in mind that there are 66,000 people who are literally homeless in LA County. So it's still like the line that I would always use on air for KPCC was just that the judge is basically the judge and plaintiffs are trying to get the city and county to do something. What
So
that is, we'll see.
Is that's not a good litmus test for success? What for a lot, and this is big,
Yeah,
it's another 30-minute conversation, but what does success look like at this point?
it depends who you ask. And every person's going to have a different measure of success. So as a part of Measure H, excuse me, as a part of Measure H, the sales tax measure, the county has created a ton of different metrics by which they measure success.
Okay.
That are largely like X number of persons provided services, X numbers of persons who we diverted from other outcomes. Like there are a lot of outcomes out there, but the gold standard is somebody permanently housed.
Mm-hmm.
But I think that one of the key problems the system suffers locally is that you have this sort of results simulation happening, where it's you're counting things and you're just counting beans, and the actual experience for the end user is not what it's not actually like. So there's an article out in the LA Times this morning about people, and I've also reported on this before, but on the outcomes from the sort of LA City's signature program, which was a bridge. It's called a bridge home. It's basically the city of LA it has invested by now several $100 million in standing up more interim shelters. Or interim housing, a bridge home, or bridge housing is the specific term for this particular type. And sure, fine, you're providing more shelter. We need more shelter. There's not enough shelter beds for everybody who's there, and shelter is ostensibly a good thing because it means somebody's not outside. The intended outcome for those things, for those structures, was that we were going to have people in and out every 60 days. That was the initial goal. So somebody comes in, 60 days later, they get a permanent housing placement. That's not at all happening. That's not remotely happening. There's people who stay there for, like the Times reporting earlier today basically was like 15% of the people who exit those shelters exit for permanent housing, where the remainder exit for a huge portion of them is just an unknown outcome. They didn't show up for 3 days and that bed became vacant again. Or they went back outside, or they went to some other interim sort of transitional thing. So I think in terms of how our system measures success right now, it measures outcomes that for the person who's that outcome, it doesn't really change anything about their situation. Like shuffling somebody from one interim housing facility to another interim housing facility, the system checks that as like avoided homelessness and like move somebody into a shelter. But like the experience for that user is not good at all. And then the gold metric of like success is the placements into permanent housing, like the procurement of a subsidized housing unit where you have a steep government subsidy that person can actually afford that. There's very little of that just because the actual housing stock does not exist or cannot be procured. And I think that's the key measure of success, and that I think is the permanent housing placement. But like there's just not that many. And then you have like locally, there's the strategy of rapid rehousing, where the county is going to provide a shallow subsidy. It depends, like just a temporary rental subsidy for somewhere between 6 to 18 months. And this is the strategy that LA is relying on very strongly to transition out of the Project Roomkey, the hotels, because again, we have a bunch of people in hotels right now, and they were put in the hotels, and that's great. People, like the hotel room is a great like piece of individual infrastructure for like managing an individual's like experience of homelessness. Now they're in a hotel, they have a place to like go to the bathroom and wash up. But like there was never a great it's still unknown where people are going to go. like there's still 3,000 people in LA County inside the motel rooms, and everybody's just really hoping the feds at FEMA don't turn off that tap of money, because if they did, well, something that we don't exactly, then we have to pay everything, and that will become very expensive very fast. Rapid rehousing, the problem is that it's predicated on the assumption that people are going to build income during the like 12-month period where they have a rental subsidy that eventually expires. Mm-hmm. But some people will, but a lot of people aren't able to, for the same reason they fell into homelessness in the first point, which is just that it's very expensive. It's a very expensive local housing market, and the incomes are not there. You cannot earn enough money, especially now in pandemic times, where maybe like, and also at a certain point, like you cannot expect somebody who's like 58 years old to like go, or I mean, you like 58 years old and disabled, like they have their like $600 a month from SSI, but they can't work. Like, what are they going to do? Like you can provide them an $800 subsidy, and between that $600 and $800, you could probably find a studio somewhere. But like once that $800 rapid rehousing subsidy expires, well, they're good luck. But then when I mean by result simulation is that even in like our current metric of success is that rapid rehousing placement is going to get counted as a permanent housing placement. They're fine for right now, but like 12 or 15 months down the line, there's a very real possibility that they're going to fall back out. Yeah. And it would be great if they could have a permanent Section 8 voucher, I guess. That's usually where local authorities, like there's always the appeal to the federal government, which, I mean, we'll see what happens in coming weeks and months, I guess. But like short of a ton, like, but then this comes back to just like the county and city do not have the money to subsidize everybody's rent. They have a lot of money and they could use the money more, like locally when you'll have advocates arguing for like, we're going to defund the police. It's like, take $1 billion from the Los Angeles Police Department, which has a $3 billion budget, and like sink that into local housing subsidies. Right. And like, not going to happen, but like that is the argument made, and that is a pile of money that the city is in custody of that like they could presume. And like $1 billion on housing subsidies would go a long way. You would be able to, especially if you turn them into permanent subsidies. Like, I don't know if the local government is interested in creating a permanent evergreen subsidy program, but like that's like something that like a lot of people argue should happen. And because of the direness of the situation and the apparent abdication of the federal government at this point, it's something that a lot of people are arguing very strongly for, like at least locally in the city of LA.
Well, Mike, it's been thrilling. I'm very interested in your work. I'm very glad that you're able to do this. What a complicated story to follow.
Very, very, very complicated.
Well, thanks for joining us. Thanks for getting us up to speed just a little bit. We've got some great links that we'll be sending out to folks of Matt's writing. Thank you, Matt.
Thank you. I appreciate it.